What are the different types of yeast infection treatments? There are a variety of treatment options for yeast infections, including creams, vaginal tablets, and oral medication. Yeast is the common term for the fungus Candida, and is most often found in moist areas of the body. Yeast infections typically occur in the vaginal area of females, but can also occur in the mouth. While yeast infections traditionally occur in the vaginal area of females, they also occur in the mouth. This type of yeast infection is referred to as thrush. Thrush is a painful condition and can lead to a difficulty in eating and swallowing. Yeast infection treatments for thrush include several options. Treatment options include eating yogurt, using an antifungal mouthwash, or sucking on lozenges that contain clotrimazole. These remedies will typically help clear the yeast infection in 5 to 10 days. Symptoms of vaginal yeast infections vary from person to person. Burning, itching, soreness, and painful intercourse are all symptoms of vaginal yeast infections. A cottage cheese textured vaginal discharge may also be present. One of the most common types of vaginal yeast infection treatments include various creams, either prescription and over-the-counter. Antifungal creams, including those with active ingredients butaconazole, miconazole and clotrimazole, can be effective yeast infection treatments. The creams are applied directly to the affected area when used to treat vaginal yeast infections. Vaginal tablets with the same active ingredients as the popular creams are also effective yeast infection treatments. These tablets are inserted into the vagina and don't have any known side effects. If the symptoms aren't resolved with either the creams or vaginal tablets, further treatment may be necessary. Oral antifungal medication can be used to treat yeast infections. The active ingredient in oral medication for yeast infections is fluconazole. Physicians usually reserve oral antifungals for more severe cases or when creams and vaginal tablets aren't working. This is due to possible side effects, such as headaches, stomach pain, and nausea. Pregnant women should avoid oral antifungal medication. Further treatment may be recommended for certain women. Those who experience recurrent yeast infections may be placed on a 6-month regimen of antifungal medication to help prevent recurrences. Women with yeast infections should speak with their doctor for treatment recommendations. Yeast infection symptoms mimic symptoms of other diseases, including gonorrhea and chlamydia. Preventing yeast infections will help reduce the need for yeast infection treatments. Preventative measures include avoiding scented products, wearing cotton underwear, and avoiding hot tubs. Other preventative measures include not using douches and changing out of wet clothing as soon as possible. Visit the website. Click below.
I hope you enjoyed our review. If you would like to order this product or see further details, then simply give us a call on the number you see on the screen right now.